Okay, sit up. Alright, so today we're gonna do some rehab for your C5, C6 left facet joint sprain. I guess it's been 5 days post-injury. So things we're gonna work on today is we really want to start working on getting the range back, especially the left rotation and left side flexion. We're not gonna focus too much on strength because all your strength is full and it's really not causing any pain, so we're not going to worry about that today. But we are going to work on your core and posture. I'm going to get you to kind of keep your shoulders back and really work on setting your shoulder blades. We're going to use some TENS to work on the to kind of help let the muscles relax and deal with the pain that you're feeling in there. Well, I'll give you a little bit of cardio to do. We'll work on some proprioception. We're not going to really touch on the neuromuscular control because it's pretty early right now, and we'll tape it up to prevent and protect it at home. We're not going to really focus on the kinetic chain right now because we just really want to get it good in the area, but in a few weeks we'll start working on your return to play and stuff like that and start working on the kinetic chain for that. So we'll start doing that and then I'll give you a home program. Alright, so first to start here, I'm going to throw a TENS unit on to help you to deal with the pain, and we'll start to have the area get warmed up. So this is just the TENS machine. What you're going to expect to feel should be a little bit of kind of a tingly sensation, and don't be worried, that's totally expected. If at any moment it's too strong for you and very uncomfortable, you can ask me to turn it down or you can ask me to turn it off. And if you stop to feel it at some point, which it will happen because your nerves will accommodate to it, then I will come over and I'll turn it up for you. So before I place the pads on, I just need to make sure you don't have any of the contraindications. So do you have epilepsy? Do you have any cancers?
No.
Do you have infection in the area?
No.
And I don't see any open wounds or cuts, anything like that. Do you have diabetes?
No.
Do you have any pacemakers or electronic equipment in your body?
No.
No. Do you have any deep vein thrombosis or thrombophlebitis?
Nope.
Alright, and do you have full sensation and no sensory problems?
No, I don't know. Correct.
Okay. Alright, so I'm just going to quickly test sharp and dull. So
Okay.
this is what sharp's going to feel like,
Okay.
and this is what dull's going to feel like.
Okay.
So just let me know which one I'm touching to your neck.
Okay. Sure. Oh. Sure. Oh.
Okay. So what I'm going to do is I'm going to palpate. I'm going to find C7, C6, and C5. And then on the left side of the neck, I'm just going to place the pads and bracket in the facet joint with them. So I'll bring this to show. So there's my pad placement. I'm going to set the TENS machine to 80 hertz and a pulse width of 150, and I'm going to leave you on it for about 10 minutes. So here, I'll turn it up. So just let me know when you can start to feel it.
Yeah, I can feel it there.
You can feel it there? Alright. So now we just want it to be strong but still comfortable, so I'm slowly going to turn it up and let me know when you get to that point.
That's good.
Okay. So we'll just leave you there for 10 minutes and I'll come get you when it's finished.
Great.
Alright. So now that your TENS is done, before we get into you actually doing the exercises, I just want to work on the spasm in your traps a little bit. So I'll get you to lie face down here. Lift your head, please. So put your face in that. Alright. Can you take your shirt off for me? Because I need to be able to get at your traps.
Sure.
Alright, so this will also help to increase the range, because I know with certain things like your forward flexion and it's tight and painful because of the spasm in your trap. So I'm just going to do some trigger point release on the spasming spots. So I'm going to palpate until I find the point of spasm, and I'm just going to hold my thumb on it for a little bit until they release, and I'm going to do that with any spots that I find. Sounds good. So you can sit up. So before we start working on any stretches, what I'm going to get you to do is we're going to work on your scap settings. So I'll get you to sit on the bed facing this way. And this will help with your rounded shoulders and everything. So what I'm going to get you to do here is press your scapula down and into my thumbs here. Hold that for as long as you can. Hold, 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 and relax. Okay, and then do that one more time. Hold, 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 and relax. So what I'm going to get you to do is 3 sets of 10, and I'll hold for 10 seconds just like that. If you start to get too fatigued and painful, you can just end the set there and move on to the next one.
Okay. And
this will really help to pull your shoulders back and keep them in a proper position. So we'll just work on this for now. When you come back next week, we'll check up again and see if there's another exercise that I can give you.
Okay.
So, alright, so you can sit facing this way now. Next thing I really want to work on for you is the range of motion that is limited. So, and I know it's pain limited, so we're just going to try and reach just to the point of pain. So,
okay.
They're left lateral flexion right now and left rotation. So the first thing I'm going to get you to do is just, actually, I'm going to do this one passively. So I get you to lie down with your head just off, on your back with your head just off the thing. Alright, so I'm going to hold your head, and I'm just going to move towards the painful range, and let me know when I hit pain, and I'm just going to hold there.
Yeah, there's
On
no
the-
pain there.
Right there? Okay. So do that. Just nice and passively. So hold there, hold there. I'm going to hold out for 30 seconds and do that 3 times for left lateral flexion. I'm going to do the same for left lateral or left rotation. Tell me when there's pain.
It's very good.
So I'm going to back off, and I'm just going to hold this for 30 seconds. We're going to do that 3 times again. We really want to get those last 10 degrees of range back in your neck, so sit back up. Okay, so next I think we can start working on some proprioception for your neck, or proprioception and neuromuscular control. So what I'm going to ask you to do is just sit, have your nice scapula nice and set like we talked about, and then keeping your eyes forward the whole time, I want you to follow your finger with my head. And just keeping your eyes straight forward. Okay, good. No, keep your eyes forward and follow with your head. Okay, that's good. And just let me know if you ever go into a painful range, and we won't go past that point. Okay. So this is just really working on the control of your neck muscles so that you can track with your head and everything. After an injury like this, it's really important to make sure that you have good neck muscles. So next I get you lie on your back again. So this will, we're going to work on a little bit more core here. So keep, like, you can slide up so your head's on the bed. And this is just some core stability of the neck. So what I'm going to start working on is, you got a bit of a chin poke here, so I'm going to get you to tuck that down in, like you're looking down towards your toes, and hold that for 5 seconds. Do it again. Hold for 5 seconds, and relax. So we'll do 3 sets of 10 of that, and same thing, if you start to get too fatigued during the 5 seconds, you can just stop there and take a break and start the new set.
Okay.
That'll be perfect for you. So, a couple of other things that we want to get going on is we'll get you working on some cardiovascular fitness. So, what I'll get you to do is just get on the stationary bike.
Okay.
And since you're a teacher and a squash player, we want to work on a little bit more of the anaerobic system instead of long-term aerobic system. So what I'll get you to do is ride for about a minute and a half at 70% of your maximum heart rate, and then for 10 seconds, I want you to pedal as hard as you can at 90 to 95% of your max heart rate. So do you know how to find your max heart rate?
Yep.
Okay. So make sure that you do that. You can find it. It's just 220 minus your age, and then you take the percentage of that. So I also want you to start setting some goals for where you want our treatment to go. I know it's only 5 days in, but it's really important to start setting some goals that we can start working on and some things we can start working towards in the rehab setting. So I know right now, I think I said this into my spieling view at the start, but we're not going to start really working on the functional and sport specific stuff because I know it's still really painful to look up when you're writing on the chalkboard or to look over your shoulder when you're driving. So we're kind of going to stick away from that right now, but I will add a little protection. So I want you to sit on the bed and face that wall. So we'll put this on at the end of every treatment for the first little bit to help remind you to set your scapula during the day. So I'm just going to set this up at the top of your accordion and pull your shoulder blade back and down, adding a bit of tension, not so much that it's pulling it down, but just so that if you start to round your shoulders, it will tug and give you a slight reminder to set your scaps again. So this will really help with the AC joint. Pull this down. So if you just unset your scapula for me, can you feel it tug?
Yeah.
And there's no tug when they're set. Is that right?
Okay.
Alright. So I'll put that on when you're done your treatments. And so that way you'll have it on when you perform the home program. And what I want you to do for your home program is just those couple of stretches I gave you. Make sure you're really working on setting your scapula, like I said.
Okay.
We'll also, we're not really doing the functional exercises, but if you have someone that can do that proprioceptive exercise that I did with you, where you trace it around, we'll do that. All right. Well, and then I'll see you in a few days again.
Awesome. Thank
All
you.
right. Thanks.